Hello everybody, welcome to Iron Vitals. I'm Prajakta and today we are discussing something very important, that is OSCE. Okay, so first of all, those who are new to this entire scene, OSCE is a part of OBA, that is outcome based assessment, which basically means that all the people who are internationally qualified nurses, say nurses from India, Philippines, Nepal, Pakistan, whatever, basically outside of Australia, have to go through this pathway in order to be eligible to become a nurse here in Australia. So OBA includes 3 steps basically. First being NCLEX RN, second is your OSCE, and the third is any of your English proficiency, and that is your IELTS PT or TOEFL, whatever you would like to take. So basically, once you clear your NCLEX RN, you become eligible to sit for your OSCE, that is Objective Structured Clinical Examination, which is a practical exam in which your practical nursing skills are being analyzed, and once you qualify that as well, additionally with your PT or English proficiency test, you can apply for a nursing registration with APRA. That is basically you become an Australian nurse. So that is the general introduction. So let's break it down bit by bit and understand what OSCE is, how you can apply for it, how you can prepare for it, and ultimately how you can pass it. Okay, so once you clear your NCLEX RN, along with your result, you will get a mail which will say that you are now eligible to sit for your OSCE. And for OSCE, just make sure you know that OSCE is only conducted in Australia, and there are only 2 centers even in Australia, one being Melbourne and second being Adelaide. So you'll have to take your exam in any of the centers. So basically what happens is, once you pay your registration fee, that is 4,000 Australian dollars, you will receive an eligibility letter from APRA saying that now you can sit for OSCE, now you can select your preferred date and you can apply for a visitor visa and come here. So there are this visa consultancies that say you can apply based on your eligibility letter, but kindly make sure you ask your agents or your whatever consultancies about this, because I think the maximum chances of you getting your visitor visa would increase when you already have a date in your hand. So once you pay your registration fee for OSCE, you will be given some dates by APRA, which normally will be after 2 months, because right now the waiting period for your OSCE exam is 2 months. So say for example, I'm applying right now, which is in July, I'll get my preferred date in September. So it doesn't mean that OSCE will randomly pick a date and give it to you. What happens is, after your eligibility letter, APRA will send you one more email which will say that next OSCE cycle is happening in this month. So basically, OSCE happens every month in Australia, and you do not know the centers already. The OSCE doesn't happen simultaneously at 2 centers. Say for example, this month it is Melbourne, next month could be Adelaide or Melbourne. That is APRA's choice. So what happens is, when you get a suggested date by APRA, it will say that okay, September 1 to September 8 we are conducting OSCE in Adelaide. So if you are available in this period of time, kindly reply us with yes or no. So they will give you a location where that cycle of OSCE will be taking place, and they will also give you a set of dates in which the OSCE will be conducted. So once you pick a yes or no, suppose I said that okay, in 1 to 8 September I'm free to go to Australia and I'll be able to take my OSCE. So in that case, I'll reply yes. So not by mail, you will get a Google Forms link, and in that link you will say yes or no according to what questions that is asking. So if you are ready and you have selected yes, you will be then sent an email by APRA in 1 week or 2 weeks, giving your confirmed location, that is Melbourne or Adelaide, your confirmed time of exam and your confirmed date of your exam. So then everything is finalized. Along with that, you will receive a terms and condition sheet where you will be supposed to sign the document, a consent for your audio and visual recording, because here in Australia you cannot record somebody's voice or somebody's video without their permission. And in our OSCE there are cameras, there are people who are actually recording what you're saying, what you're doing, everything. So basically you will be signing a general consent form, and the second will be the terms and conditions. So you will sign this papers, you'll basically take a printout of it, you'll sign it, and then you will take a scanned PDF and then send it back to APRA within 28 days. You'll be clearly given all of this into your email, so do not worry. The application process is really simple. You can do it on your own. You do not need to go to any agency to complete all of this paperwork. So once that is being done, now you have a period of at least 1 month before sitting for your OSCE. So once you get your dates and eligibility letter and everything, you will apply for a visitor visa if you are offshore. So visitor visa approximately takes up to 15 days max to be granted. So once that is done, once you receive your visitor visa, I would say just run here, because you need at least 1 month of preparation for OSCE. That's what I did. Actually, I did not have to lodge a visitor visa because I was already here, but I practiced for a month. I joined a coaching center that is you might have heard, that is NAI, Nurse Assist International. This is not sponsored. I'm saying this because a lot of internationally qualified nurses do not know where to go in Australia, where to stay, what to do, and they just go confused. So not a sponsored thing, but I would like to highlight that these people give you accommodation facilities, this people give you a lab where you can practice 24/7, and then there are face-to-face lectures and online lectures as well. So the fees is approximately 2,500 Australian dollars. This is just the general information. I do not insist you that go to NAI, join that and start preparing with NAI only. But just in case you're having no idea about this, this is one of the centers you can go and practice. I really had a great experience there, great mentors and everything. So that's about that. You can find them online. If you cannot, I'll drop a link in the description where you can go and check it out. So let me give you a brief information about how the real OSCE takes place. So OSCE has 10 stations. Each station has its own setup. There will be a patient, there will be an assessor, and there will be a second nurse if required. Now you will not understand the concept of second nurse, but basically here in Australia, if you want to do certain procedures, you need one more registered nurse with you to basically do the checks and do the procedure with you, because some things are big deal here. You will realize those things when you come here and practice. I cannot disclose more, but make sure you go through the OSCE handbook, which has every information that you need about OSCE. Most things I'll be talking here, but still I would recommend you please go and read that handbook. If you have nothing to do right now, just read that handbook every day. You'll get a lot of information. I'll drop the link in the description. Also, there are real pictures of lab in this handbook. Not lab, basically the center where this real OSCE is taking place. So by 10 stations, I mean there will be 10 different rooms. There will be a chair in front of every room where you are supposed to sit and read and then go and do your procedures. So every station will have 10 minutes of performance time. 2 minutes will be your reading time, and 8 minutes you will be doing the procedure inside the room. Until those 2 minutes, you are not supposed to go inside the room. 2 minutes you are only sitting outside on the chair and just reading the scenario, taking your notes, and then you'll go. If I give you an example, imagine that there are 10 rooms, 5 this side and 5 this side, and every station will have a number 1 2 3 4 5 6 7 8 9 10, and you will be 20 students performing at the same time. So you will all be given a random number, and from that random number you will be completing one whole cycle. So the moment your exam starts, you will be completing those 10 stations anyhow. That's the whole point. So you'll be rotating yourself, that's the thing. So that's about the exam. So if I talk about the setup a little bit, every room will have its own patient, its own scenario. Scenario is basically what your patient's condition is, what you are supposed to do, what procedure you are supposed to perform. All of that is your scenario. You will get to know more when you practice it. I cannot disclose more because of the confidentiality agreement that I have signed with APRA. So make sure you do that as well. You are not supposed to breach the confidentiality, because Australia is very, very, very serious about that, and it can take your license away. So be very, very careful. So that's about it. Now I would like to give you some tips or some things that worked for me, and hopefully that would work for you too. So just listen very, very carefully, because you might not realize how big this thing is, but OSCE is literally one of the toughest exams I had given in my life. This might sound weird because there are 10 stations, there are a number of procedures that you need to prepare, and you need to go there and perform. But to be honest, when you're paying that 4,000 Australian dollars, when you are sitting there, it's literally like Squid Games. You're like do or die. You want to go to the other end anyhow. But to be honest, there's one tip you can try, you should do with yourself. Please regulate, please manage your stress and anxiety from today onwards. You do not want to be so pressurized, so stressed about 10 things while you are giving your OSCE. Because what happens is, I'll give you a real example that happened with me, that happens with most students when they are taking their OSCE. What happens is, you do not get any break once you start your OSCE. So suppose I started with my first station, whatever was my first station, I did not do well. Imagine, I did not do very well in my first station. The moment my time stops, the moment my 10 minutes stop and I get out of the room, my mind is still there. My mind is still in the first station. Oh my god, what a blunder I created. I could have done better. How did I forget this little thing? And now, this is the time when I'm supposed to read my scenario for the second station. The 2 minutes bell has rang, and now I'm sitting on the chair of the second station, and I'm supposed to read and understand, but my mind is still busy, comprehending my experience with the first station. What happens? You will carry it. You will carry your bad performance in every other station. So make sure you don't do this. I know saying is very easy, sitting here, that make sure you do this, make sure you do that, but just keep in your mind that you can only do your best. That's only in your hands. So please manage your stress, please manage your anxiety, and please learn how to move on from one difficult thing or one bad thing that just happened last minute ago, that second ago. Just forget it and move to the other thing that you have to continue. That's first tip. Second tip, please pray to God every single day. Pray to God, because that is going to help you with everything. The type of patient you are going to get, the type of scenario you are going to get, the type of day you are going to get on your exam, it all is in His hands. Every little thing that is happening, that will affect you. So make sure that you pray to somebody that, please, whatever is not in my hands, please manage them in my favor. So that's tip number 2. Tip number 3, this is the most important tip. This could be a little longer, but I'm so sorry about that. I need to tell you this because you cannot mess this exam up, because this is so very important for you. So the tip number 3 is that when you're practicing in the lab, when you're practicing with your colleagues, a lot of times you'll feel like, oh my god, I don't know anything, and there are people around me who know everything. They are mastering that procedure, and I do not know how to even start this procedure. Do not compare yourself. Do not compare yourself, please. So basically what I'm trying to say is, do not get overwhelmed with somebody else's performance. You can master it too. You can practice 15 times a day and you can get there. But right now, at this point of time, do not make yourself so inferior. Do not feel yourself very inferior that, okay, that person is going to pass and I do not know, so everything is over. Just try to control things that are in your control: your performance, your anxiety, your stress, your thinking, your ability to perform, your ability to communicate, your ability to empathize. All of those things are in your power, are in your control. So make sure you are only focusing on those things, and while you're performing, make sure you have friends around yourself, colleagues around yourself, who will give you the real feedback. So what happens is, when you're practicing in the lab, you will make somebody your patient, you'll make somebody your second nurse if that is required, and you'll be talking and you'll be rehearsing your procedures. So at this point of time, if you have your very close friends as your patient and your second nurse, they will not give you any honest feedback. They'll say, yeah, you did great, and you're speaking nice and you'll pass. Have people who have the guts to tell the truth right on your face, no matter how bad you feel, because you need it. You need honest feedback to pass this exam. Second thing, do not practice with your family members, do not practice at your home, do not practice with the people you are very used to. Practice with strangers, practice with people who are very harsh and rude. They will tell you the real truth, they will tell you what your weakness is, and that is the most important thing. OSCE is all about practice. The more you practice, the more your skills will be sharpened. So that's that. These are the 3 most important tips that I wanted to give. Other than that, if you have any doubt, you directly go to one who has taught, the teacher. Do not ask your friends, do not ask your colleagues. Make your own notes and go through them until you are confident. So practice until you are confident, and once you're done, just give yourself time to understand all those things, process all those things, sit with yourself, and just help yourself being more confident and just more positive. That's very important. So once you give your final exam, you will receive your result after 1.5 months, that is approximately 4 to 5 weeks. So until then, you'll have to relax and sit and wait. So that's pretty much everything about OSCE. I think I have covered everything. You still have any doubts, confusion, queries, make sure you drop them down in the comment section below, and stay tuned. Please subscribe and share this video with all your friends, and until next time, happy RN.